You have to put into perspective. The platelets need to sense air. What if the blood vessel that burst was inside you? Yes, that's what you call internal bleeding in layman's term. Okay? Because there's no air for the platelets to sense. So what will happen? You'll just keep on bleeding. When platelets sense air, it leads to what's called the plug formation. Chemicals are released, leading to the formation of fibrinogen. Fibrinogen is the strong substance that helps keep the platelets put together. And of course, more fibrin comes in to eventually seal. Okay? To eventually seal that cut. The problem with fibrin, okay? Fibrin also leads to what? It also leads to scar formation. Okay? Let me ask you about scars. For example, someone slashed you here. Okay? So eventually, of course, you got yourself treated and they closed up the wound. You will have a long scar here. Let me ask you, whenever a scar develops, when will that skin return to its normal strength? When do you think? After a scar develops. When will the skin return to its normal strength? Remember, our skin has strength, right? But it's been cut. So now there's a scar. So technically the skin has been pushed together again. When will the skin return to its normal strength? Never. Okay? Note that whenever a scar occurs, the skin will never return to its normal strength. Okay? So atherosclerosis, normal human artery, there you have it. You have the endothelium. The endothelium is a layer of cells. Okay? Inside the vessel. Outside you have the smooth muscle and fibrous tissue that covers it. The smooth muscle is responsible for what? Vasoconstriction and vasodilation. So what happens here? What happens eventually is the endothelium gets damaged. How does it get damaged? Because of the deposition of fat. The fat does not just deposit on top of the endothelium. It eventually makes its way into the endothelium. And because that endothelium becomes damaged, what happens? You start to have platelet aggregation. Eventually, formation of thrombosis. As time goes by, lipids, calcium, cellular debris all make their way here. The macrophages become foam cells. What are foam cells? These are macrophages that have ingested fat cells. Okay? Foam cells, you have histology, right? You have not taken this up in histology yet? Okay. Foam cells are macrophages that have ingested fat cells or lipid cells. Okay? Lipocytes. So all of this start to build up. What happens to the radius of the blood vessel? It starts to decrease. Good. So what happens there? Coronary ischemia will then start to occur, leading to an insufficient blood flow to the cardiac muscles. What happens then again? Depresses the metabolism of the heart, as I mentioned this earlier, because of a lack of oxygen. Excuse me. Oxygen, excess accumulation of CO2, and lack of sufficient food nutrients. And of course, repolarization cannot occur in these particular areas. Okay, I mentioned this earlier, right? Lack of oxygen, excess accumulation, and lack of nutrients. Okay, so looking at it from the side view. So we looked at it from the front view. In atherosclerosis, there is deposition of fat underneath the endothelial layer. The deposition of fat underneath the endothelial layer will then cause damage to it Okay? So what happens there? In advanced stages, is the flow still laminar? Do you think? No. There will be abnormal flow. Because remember, if we try to flow above, go down, right? Above and go down. So there you have it. The fat deposition. And then the macrophages immune system tries to eat some of this fat and becomes foam cells. Good. Okay? Eventually, because of this process, even the muscle layer, the smooth muscle layer, becomes abnormal. It becomes abnormally thick. Why do you think this would become abnormally thick? Remember, we'll talk about this when we talk about blood vessels again. But if you take a hose, a garden hose, you let the water come out, and you press the hose and you decrease its lumen, what happens to the pressure of the water? It increases. Because the pressure has been increased, what do you think will happen to the muscle? The muscle, technically, there will be some form of hypertrophy on the muscle part as well. Because it is now handling a higher pressure inside the vessels. Eventually, some new muscle cells will be recruited, okay? The artery becomes more narrow and narrow. Eventually, what happens here? How would an MI occur? You see the red blood cells? See how big they are? What will happen if this moves up to here? The red blood cell cannot move through, and all of them will start to traffic at this end, causing thrombosis or a blood clot. Okay? So there you have it. This is opening, and then a beginning cholesterol plaque. How early does cholesterol plaque build up? Anyone know? 2 years old? Wow, so mean. Okay, you're so mean. As early as 2 years old, start building up. Okay, as early as 10 years old. Okay? If you have what's called familial hypercholesterolemia, this process can be accelerated. So in us right now, we already have cholesterol plaque in our blood vessels. I said, unless you're vegetarian and you never eat meat in your life. Okay? But remember, it's not just meat. Dairy products also have cholesterol as well. Okay? Now, that's why there was a debate among pediatricians before. Should you disallow children as young as 10 years old to stop eating hamburgers? That's a debate. It's never resolved. Okay? Because if you look at theoretically, if that's the case, as early as 10, people should already start watching their diet. Okay? Now, as the years go by, I'll actually show you later, as the years go by, this plaque gets bigger and bigger and bigger, and eventually you have a drug. Now, how can you slow this process down? Does anyone know? Don't eat meat? Okay, what's the rationale? Why should you not eat meat? I'm not saying you should eat meat, but why should you not eat meat? Because of saturated fat from animal fat. Okay, saturated fat. Now, in this case, but of course, you know, I mean, if you don't eat meat, you deprive, well, for those who are used to eating meat, you deprive yourselves of the best things in life. Right? Wow, that was yes. So, I'm glad you agree with me. Okay. The best way to ensure that you keep yourself healthy is to ensure you have a high fiber diet. Meaning, you can still eat meat, but you gotta make sure you also eat things like leafy vegetables. If you're gonna eat bread, go for the whole wheat type of bread. They say even if you eat rice, go for brown rice.